A very good evening to you all wherever you're watching Bethany TV from. Welcome to Medical Minds. In today's episode, we have our topic, and that is infertility in men. Welcome to Medical Minds. Once again, I'm Teacher Zita, hosting Dr. Andabra. Today is Sunday, and we're going to look at infertility today.
Yes, good evening, viewers, especially the men.
Yes.
So you're most welcome to join us in the discussion.
Thank you so much, Doctor. Let's go straight to our topic of discussion today, infertility in men.
Yes.
What is infertility in men?
Yeah, so we talk about infertility in men, specifically when a couple fails to get a pregnancy in 1 year of trial, and you have found out the problem actually is in the man.
Okay.
Yes.
Okay, that's very good.
Yeah.
How does one know that they are prone to infertility? How can a man know that it seems I am infertile?
Yeah, so unfortunately, apart from the fact that you have to wait for the 1 year of trial, and then you don't get a pregnancy at all with your wife, and then you get to know. There is no other way of knowing. The rest is usually looking at the causes.
Okay.
Of course, there are a few other situations, for example, when you have problems with erection, you know, if the man has a problem with erection or is having issues with ejaculation, those ones, they can be able to know.
To know that they are.
Yes.
Okay.
But apart from that, the rest has to be worked out from the health unit.
Okay, someone called me yesterday, and because I told them that we're having this topic, then it was like, can you please ask doctor, is the size of my male reproductive system determining my fertility or infertility rate, something like that? And I was like, how old are you? He was like, I'm 19 years, but it looks like for a baby of 10, 11 years. I was like, okay, I'll ask doctor. Does that determine that?
The answer is yes and no, because there's the normal size of the penis. It varies depending on whether it is in erection state or it is in a flaccid non-erectile state.
Okay.
This is one. But if the size is small, extremely small, when it is not in erection state, it could be a sign of an underlying problem.
Okay.
Yes, so it is possible, but it needs to be evaluated to see whether it's that. So it cannot be ignored, but of course, by and large, and also among the normal ones, there's a big variation, you know? Yes, like how people's sizes are, others are tall, others are short.
Yes.
It doesn't mean that they have an abnormality.
True.
Yep.
Let's look at the possible causes of infertility in men. Last week it was women. Today it's men, and yet to a larger extent, men think the fertility issues are for ladies. So today we are talking about men. We want to look at things that could be causing infertility among men. Yes, doctor.
Yeah. So well, before we look at the causes. Actually, it is not only men who think infertility is a problem of women. Even some women think it is their problem.
It is our problem.
Yeah, see, when a couple fails to get a pregnancy,
they think it's the lady.
The lady herself even thinks
because women were first, so and so is the saying.
So it is like a general problem. People think the problem is usually in the woman. And incidentally, that's not really true.
Okay.
Because what we know is that in about 30% of the cases, we see the problem is in the man. Actually, it is distributed equally because we know in the 30%, that is 3 out of 10 couple, the problem is actually in the man. And 3 out of 10, the problem is in the woman. About 2 out of 10, we don't get to know the problem. In about 1 out of 10, the problem is in both. Yeah, so it's quite common actually. The problem in the men is common.
Okay.
Yeah, so the problems are actually numerous.
Okay.
They are quite numerous, and they can range from problems with sperms, abnormalities of the sperms. Those are hidden, and you have to look for the sperms to understand.
And sometimes
them.
you might not know.
In most cases, you will not know that
you
problem.
Successfully have intercourse.
Yes.
And then you also release
exactly. Yes. And then that
but
fluid
you fail to fertilize.
Yes, that fluid you release is supposed to contain normal sperms. So in terms of numbers, in terms of shapes, in terms of their ability to move, in terms of their ability to fertilize. So the abnormality could be with the sperms. We will look at some of those. Yes, so there are several abnormalities which can happen with the sperms. For example, yeah, a good sperm is supposed to be very nice and healthy like this. It has principal key parts like this, the head. This head is very important because here it carries the genetic material. Okay. And then it has a neck, which we sometimes call the middle piece. Okay. Now this has these things here. We are representing the energy source. So this is the one which provides the energy for the sperm.
It pushes it further.
Yeah, it gives it is the energy. It is the generator actually. It's the energy source for the sperm. Okay. And then down here is the tail. Now these are supposed to be in the same in a specific shape and in a specific size. Okay. Like this. So abnormalities can occur in the sperm's head. For example, here we have abnormalities of the head, small, tiny head. So it is so small that it may over squeeze the nucleus, or things here, other things may not enter like this one in front. Okay. And or it may be too heavy, too big, so it can't carry it. Or the whole sperm may be small entirely, or the head may be double, both of them, two heads.
So that two-head one is, what is it? Is it a twin? Is it a, what is that?
Now that is not a twin, that's an abnormal sperm. It will not fertilize. Really? The egg will not accept it to be fertilized. Okay. These are supposed to be two sperms, but they failed to separate. Okay. Yes, so, but they cannot work. Or the head may be completely amorphous like that.
Funny.
Yes. So the problem may also be in the, so there are so many problems. It may be in the part which is generating the energy here, the neck. Okay. So it can be twisted, or it can be bent, or it can be swollen, it can be completely absent, or it may be too long, or it may be
too short.
Too short, yes. So all those are there. Okay. And then you can have abnormalities of the tail.
This is the mid-piece defect.
Yes.
The other one is the head defect.
Yes.
So now there is also tail.
Tail. So it is so many things you expect. So
goodness.
So you can see sometimes the tail can be missing completely. So this cannot move.
So that one is completely lame.
Yes, it's completely lame, like no legs. It is stuck. Once it is released, it is there. It will not move. Okay. Or the tail is too short, so this one will be the will not finish the journey. It's like
just
somebody
stops around there and comes
with the short legs, maybe up to the knee. You can't walk.
Surely true.
Or it may be a long tail, but the end is bent, kinked. So
just to be just like this.
Has to move has to be like this so that it is able to move very well. Yes, sometimes they are too, so they will not move well. They will be wobbling. For example, if you have 3 legs,
there's no way you can really move.
Yes, so. Or it is coiled, it can't move, or it has some drop on the end, which is like an extra load. It's like having an aeroplane with you put the luggage on top of the wing, so it can't move. Yes. So you see the sperm abnormality, all these variations are possible, and we do see them in clinical practice.
And unless you take a test, you can never detect such.
You can never. This one you have to look at it under the microscope, a specialized microscope, to see and study the structure of the sperm. So it's so the problem may be just with the sperm. Yeah. Sometimes
sperm abnormality. Because sometimes someone was telling me he was tested that the sperm count was enough, but still he can't fertilize. It could be this.
It could be this. It could be this. Now this is what you see with the microscope. Now the current evaluation of the sperm has even gone up to the level of the genes. Really? Now we're able to assess the integrity of the genes here. So sometimes you find the sperm is actually completely normal like this, but has damage of the genetic material. And so because there's damage in the genetic material, the sperm will reach the egg, it reaches there and it can't fertilize. Yeah, so that also happens, and we're seeing them. Okay. Yes. Yeah, wow. So problem can be with the sperms like that. Yeah.
Thank you you so much, doctor. Yeah. What could be causing these
abnormalities? Yeah, so different things can cause these abnormalities. Some of the problems are genetic.
They're inherited from parents.
They are inherited from parents, and they go on, and then they come like this. Some of this because of course, basically these are problems which affect the formation of the sperm. So it can be genetic defects, or can be some problems like drugs. actually.
Drugs like which ones?
People who take recreational drugs are very notorious. Cocaine. Yeah, people who even smoke, who smoke marijuana, all those things.
Especially those who do it excessively.
Excessively. But there's no like safe dose for those things. They are all teratogenic, because the problem is what may be safe for me may not be safe for another person.
True.
Yeah, so it's better to avoid all those.
Okay.
Yeah. People who go so much in the sauna are prone to having a low count of the sperms, and sometimes their sperms have abnormal heads because it interferes with.
Doctor, let's talk about sauna.
Yes.
Well, I don't know what happens much in the sauna. Because the male reproductive system is hidden down.
Yes.
And then I think the heat, I don't know whether they dip themselves in hot tubs or water,
yes, so,
or the entire room is hot or something. So how does the whole room is too hot? Yes. So how does it affect the inside?
Ability to produce the sperms.
Yes, yes.
So maybe let's have an illustration of the male reproductive system. The male reproductive system picture over here. Let's see, male reproductive system. Yes, like right here. Okay. So you know, this is where science becomes very interesting. You know, medicine or biology is basically understanding creation. The creation story. God's wisdom. God's wisdom. Now, God in his own wisdom put the testes where sperms are made to be outside the body. And that's for a reason, because the required conditions for making the sperms, one of them is lower temperature in the testes. Okay. It has to be at least about 2 degrees centigrade, lower than the body temperature. Okay. So it has to hang out. Now, if the temperature is raised beyond that, then the factory, which is the testis, the function will start dropping down.
Okay.
Now, when people go to the sauna, they are doing exactly that. They are raising the temperatures of the scrotum and the testes beyond.
They're seriously boiling them.
Yes, they are boiling. In fact, it's like putting this in a, you see like how they boil eggs.
Yeah.
It's like boiling your testicles in the eggs, in the hot water. Yes. So it's not a good practice, especially if you're doing it, because some people are saying, okay, I have been doing it and I'm not affected. You know, God was wise, because God also knew human beings are insane, because now he gives a big range for you. He gives you a sperm count of about 200 million per mil. With your recklessness, you can drop it down to maybe 90 million.
Imagine.
You can still function, yes. But you know, God is forgiving you there. But if you are very unlucky and you started with 50 million and you drop it down to 5 million, you are already in trouble. Yeah, so some of those things you have to be very careful about it. You have to be very, very careful. Sauna is notorious. And chemicals like smoking, the contents of the smoke, even alcohol. And excessive drinking of alcohol, especially excessive drinking of alcohol, it lowers the sperm count. And yeah, so actually there's a recent study which is actually showing that the trends are showing that male fertility is dropping, and it's worrying us. It's really worrying us, because... And especially in the young men, imagine. Yes, the trends are not very good. The fertility is dropping. Dropping each and every day. Sperm counts have dropped by like 20% in the last about 10 years. At this rate, we will have some families. It's not a good thing. True, true. Thank you. Thanks so much for that illustration. For all of us who are following us, and we've been longing to meet doctor and listen to explanation, I think you're getting it well. Sauna should be avoided to a larger extent. We are boiling the system, and then in the end, we look for solutions which cannot be provided. So someone is asking that, so can sauna be another mode of family planning? If you don't want to give birth, you go straight to the sauna. You go and burn the you boil them. Oh, well, I really don't think so. Of course, if you have finished your family and you are not bothered about the status of the sperms, it will be okay for you to go ahead and enjoy it.
Okay.
Yeah, there's nothing to worry about. But to use it as a method of family planning, well, its effectiveness we still don't know.
Okay.
Yeah. Yeah.
Thank you so much, Doctor. So after all these challenges and signs and symptoms of infertility, are there some possible ways of treating or giving some men some hope?
Yes.
Especially those who inherit. Let's leave alone those who burn it intentionally or ignorantly, but those who inherit and grow up with it. Are there some treatments?
Yeah, there are treatment options. There are a number of treatment options available. Some of these things are reversible. Maybe if we had gone into details about some other... Do we have an illustration
where we can, like we did last time?
Yes, so maybe we can look at other causes of male infertility, and then we can pick it up from there so that we can see, yes. So among the causes, we only talked about sperm abnormalities, which can be showing in the semen as a semen abnormality, yes. But also it can show other causes of abnormalities causes of problems in the sperm are also varicose things.
Well, what are those varicose?
So what happens here is still related to the temperature. The testis is supplied by some blood vessels, which come from the body, go through the root of the scrotum into the testis. And then that blood has to go back. Now, as it is going back, it is being taken by a number of veins. Now, in some people, and this arrangement is supposed to be such that it lowers the testis temperature. But in some people, the veins swell. Now, when the veins swell, they will not be taking back the blood. Yes, they will not be cooling. Be some blockage somewhere. Yes, they will not be cooling as fast as they should be cooling. Yeah, so when that happens, then the temperature starts being transferred to the testis. So eventually you find the testis getting hot again. Yes. So when the testis gets hot, then you will disrupt formation of the sperm. So it is very important that if somebody has an issue with conceiving, that part is examined by the doctor very well. Yeah. And then another thing we also need to look at is damage to the testis. Now, we need to mention this because some of the social activities actually do result into this.
For example?
We are seeing this in some forms of sports, especially rugby, rough games.
Those rough games where everybody is pushed like...
Yes, those rough games and people who ride bicycles
for long.
Yes.
How about drivers who sit for many days driving from Mombasa to Kigali?
Now those ones, the problem is the heat. Their chair gets hot. Their chairs get hot, and eventually the testis also gets hot, and that's when they get the problem. So we also see their sperm counts dropping. Yeah. So, but people who get trauma to the testis, either kickboxing, those ones you find, damage to the testis. The funny thing about this damage is that it may be very small. You feel just a small pain, and then it goes off. Now, that you shouldn't ignore, because what happens is the testis, like the eye, is not available. The body doesn't get to know it in details. But when you get it damaged, the immune system of the body gets to know the testis and starts to fight it. So you find that small damage will expose your body to the immune system, and your immune system will start fighting your testis. So it will destroy it, and you find eventually your testis becoming smaller and smaller, and you wonder what happened. Sometimes you don't even remember.
What happened?
Yes, you don't even remember, yes.
How about the swellings in the testes? Sometimes some male present or swollen testicles.
Yes, that is called the otitis, infection of the testes. It's one of the causes of infertility in men, actually. So untreated infection of the testes, either it's viral or caused by virus or bacteria. So these things should not be ignored, because if you treat them, you can prevent the long-term effect on somebody's fertility. And then we also have hormone-related issues. Yeah, because the reproductive system is controlled by hormones, right from the brain and even to the testes. Some people are born with some hormone issues, or some of them acquire those hormone issues later. Some of those show out. Now, one of the most important things I want to mention about the hormone issue is there are people who use quietly recreational hormone medication. And it is increasing in our population because you see, there are people who want to build muscles, especially people who visit the gyms so much, and we need to pay attention to this. I think they take those drugs which enhance their male hormones. And unfortunately, these male hormone enhancing drugs, which you take from outside, they suppress the inside ones, and so they reduce your sperm count. Yes, so we are beginning to see some of those showing up. So you find somebody is very muscular and with beards and is bouncing.
But down there, nothing.
You find the sperm count is negligible because of that. And the unfortunate thing is most of these people don't tell it to their spouses.
Don't even realize it, actually.
They don't realize it. They don't tell it to their spouses what they are doing, And you see, so it's beginning to show up as a problem. But some few people, you can't find the cause. And this doesn't mean that there's no cause.
Of course, it could be there.
Yes, except that the current level of science has not been able to identify them. So those are the areas of research.
Okay.
Yeah, so the causes are very many. Because remember, 30% of the cases of infertility are due to causes in the man.
True.
So these all play there.
Now we are beginning to see the reality where infertility is more and much bigger. We used to think back in the days that it's a woman's issue. Now we are seeing the reality where it comes from. I think men carry the biggest percentage, according to research, somehow. Because if men have all this blah, 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 it's quite a lot.
It's a lot.
Quite a lot.
In terms of statistics, actually, we now know that if you take 10 couples with infertility who are struggling to conceive, about 3 of them, in 3 of these couples, the problem will be exclusively in the man.
Okay.
3 out of 10. Now, in other 3, the problem will be exclusively in the woman. Yeah. In the other 2 out of 10, the problem will be unidentified. You can't find out.
You can't find the cause.
But in about 1 out of these 10, the problem will be in both.
Thank you so much, Doctor.
So that's how it's distributed in our population.
Thanks so much for that excellent explanation. Since we're talking about men, there's another inquiry here.
Yes.
Let's talk about masturbation. Does that cause also infertility? Because you find that most men who masturbate, with time, they become, I think, unable to do what is needed of them.
Yeah.
Does masturbation cause infertility in the long run?
Yes, that is, you see, we used to ignore it. I can tell you in my practice now, I see a number of men who come in with that problem. Yes, they have the commonest presentation is erectile dysfunction. So they are not able to perform normal sexual function with their wife.
Doctor, to a layman watching us there,
yes.
Let's talk about erectile dysfunction. What is it exactly?
Yes, so now how the man's body works is the man's system is supposed to produce sperms in the testicles, right down here. And then when the sperms are mature and at the time of intercourse, the sperms are passed with the force and pumped through this channel. And then right down here is supposed to pass through a penis which is erect and is able to end up properly into the woman's vaginal canal properly, so that it is delivered in the right place. Now, for the people who do masturbation, now for this erection to be maintained, the erection comes as a result of blood going into these muscles in the penis, and that blood is pumped under the influence of the nerves from the brain. So it needs some stimulation, and then that stimulation is able to stimulate, to cause blood to be pumped into here, so that this is turgid and is able to erect well.
Okay.
Yes. Now, what happens in the people who do masturbation is that they use their hands to stimulate the penis. They rub on the penis, and that rubbing is hard. And it gets harder. And for them to always get stimulation, the rubbing has to be harder. And they get to learn how to do it. And you cannot achieve that in normal intercourse. Yes. So their body gets used to the process. Yes, to the force, the process. And so the circuit is complete within them and cannot allow the normal interaction to cause this. So they lose the ability to gain an erection and sustain an erection in a normal heterosexual, interaction with a woman. So they always get problems with erection. They get problems with erection, and some of them, they lose it so completely that even the sight of a woman switches it off. Yes, so they get very severe psychological problems which makes them to lose erection. Yeah, so that so definitely can cause infertility.
Thank you. Yeah. Thank you so much. Yes, we are going to have a very brief break. We are still talking about infertility with Dr. Underbart, and if you're following us, please stay right here. Don't go away because we're going for a break. And back from that break, it's still Medical Minds, and we're talking about infertility. We have a Winshule Park going on promotion for all the learners, all those who follow this show. Please make sure you keep on tuning on into Bethany TV so that you can win yourself a school park where you'll have a lot of things like pens, reams of papers, bottles, sanitary pads in case you're a girl. So please, this show is starting, the promotion is on and everything. So in case you are watching and you've been having your query about masturbation causing infertility, yes, in the long run, it can give you a lot of hard time when you're really looking for that time to fertilize the egg. So, Doctor, we'll come back from that break. Let's look at a possible treatment, yes, in male infertility. Yes.
Yes, possible treatment for infertility in men. Now, yes, before we go to the treatment, I would really want people to emphasize prevention.
Okay.
Yeah, it's very important for people to take care of their health by preventing these things. For example, avoiding things like excessive alcohol, smoking, doing saunas all the time, and use of recreational drugs. If you can avoid those, then you'll be left with a few things to deal with.
That can easily be.
Yeah. Then so in terms of treating those who end up in this problem, again, the treatments depend on one, identifying the cause. Yes, what is causing the problem. For example, if the problem is caused by, for example, use of those things, you tell them, please stop them. And in most cases, they will regain if they have not been using them for long. Yeah. But for others, the problem may be hormones. Yeah, others, without their notice, their hormones, the male hormones, are either too low or too high, and then you find the production of the sperm is affected. So in that case, we're able to remanipulate the hormones into the normal ranges, so this needs medications. And the body will be able to function normally and produce the sperms.
Okay.
But there are some few cases which need some other forms of assistance. For example, that's where you need to do assisted fertilization. So the sperms are too few or they are too weak, they are not able to fertilize the eggs. So we have to get the sperms and we get the eggs out and fertilize them out. Okay. And then put in the woman's womb. Or if the sperms are too few, we may need to do insemination. That's the case where we'll have to do insemination. Yeah, so there are treatments available.
Are there some tablets someone can swallow?
Yeah, so if the cause is already identified, there are a number of tablets which are available. Okay. Yeah, so there are a number of tablets which are available. Sometimes you take them alone, others you take them in combination, depending on the result of the evaluation. Okay. Because sometimes the issues, you have to balance the hormones, but also you have to do other things as well. So, but the treatments are available, just to tell people.
Okay.
Yes.
Thank you, doctor. At what stage should a man worry about infertility? At what stage, like
so actually, in terms of reproductive potential for both men and women, this should be watched right from the time somebody is born.
Okay.
Because some of these problems, they occur at that time. For example, if somebody has testis which does not descend into the scrotum, you know, by the process of making the body for the man, for the boy, the testis can confirmed.
When the child is still young?
Yes, when the child is still young. So that when it is found to be either stuck on the way or it is still inside, then an operation can be done to pull the testes into the right place. And if that is done early, you can rescue.
Okay.
Yes.
Thank you so much.
That should be done at every stage. Then when the person reaches like a teenage, the child should go through the normal development stages. They should develop what we call the secondary sexual characteristics, like the voice changes must occur. Yes. The development of the hair must occur. And the changes in, for example, the pubic hair development must occur. If they don't occur, it might signify some real issues which could affect their reproductive potential. So it should not be waited for up to the end. We should look at this as parents, and if the development is okay, then you are left with a few things to deal with. And now the person, when they get married, they can look at this in case they are not able to achieve a pregnancy within a year. So it should be comprehensive right from birth.
Thank you. Thank you so much. In case you're watching us, it's still Medical Minds, and we're talking about infertility in men. Our lines are now open. You can send us your WhatsApp messages. Doctor is here. He will give you back all the answers that you need to know. You can as well call us, and then you give us your questions. Someone is on the line. Bethany TV, hello. Hello, caller.
Yes, hello, doctor.
Hello.
Yes, doctor. Good evening.
Good evening to you. Who is calling?
You're speaking to Paul.
Yes, Paul. Where are you calling from?
I'm calling from Seta.
Please, go on.
Okay. Before, around 2017, I had a problem of passing urine, painful urine. When I'm passing urine, I feel some pain.
Okay.
But I went to the hospital and they did the culture, but they couldn't do anything.
Okay.
Then last year, I went for a scan.
Okay.
They got that I had some enlarged prostate. And I had even some gout. And I was given with medication. I finished the medication, but sometimes I can feel pain when I'm passing urine. How can I make it?
Thank you so much, Paul. Did you get the question clearly, doctor?
Not very clear, but I see he's telling us a story.
Yes.
His story from when he was still before 17.
2017.
It was 2017?
Yes.
Oh, I got as if he got problems with passing urine. Yes, and then later he was checked and they found out he had issues with the prostate. Prostate was enlarged.
Yes, yes.
And then
he was given medicine.
They are giving some medications to help him with it. I
But still he's saying the pain still, for now the pain has started coming, it comes
back.
on. Yes, yes.
Oh yeah, so well, I think Paul, thanks for that question. If maybe you can ask it again, but we can answer, maybe we can give some clarification on what we understand.
True. Paul, you can as well send an SMS or a WhatsApp message so that we get the question clearly. All we had was pain and medication. Yes, you can as well send a message and we get it clearly. Yes, you wanted to answer something?
Yeah, so the issue, I think his problem he's talking about is all about the prostate area.
Okay.
I think he said he had some pain on passing urine. They gave him treatment and then they did a scan and they found out his prostate was enlarged. Now, if the problem is the prostate, this is actually what happens. You know, this is the bladder, the urine bladder here, and so the urine bladder empties into the penis through a channel here we call urethra, and the prostate is around the upper part of this channel.
Okay.
Yes. Now when the prostate enlarges, it squeezes this. It squeezes and sort of blocks.
That tube blocks.
Yes. So it becomes hard to empty the bladder, and you have to squeeze to make the urine come out. That can pain. or infections can start setting here because
of course the urine is not passing out.
The urine is not coming out all. So that can be a disturbance.
Okay.
Now, there are different treatments they do give. Some people, if they find out the enlargement of the prostate is not so much, they give some antibiotics to make the prostate infection to go off, and then the channel becomes okay. Others, they give medicines to suppress the enlargement of the prostate.
Okay.
Yeah.
Thank you.
Now, but if any particular treatment is not working well, he must go back
and seek better medical checkup.
Yes.
Thank you so much, Doctor. You have other questions here. Yes. Dear Doctor, I have two questions. One, what causes retrograde ejaculation? Okay. Two, is there a link with male infertility? Is there a link with male infertility with witchcraft? Something like that, Sam.
Okay. Yes, so he's asking about retrograde ejaculation. Now, we can use this same thing here to illustrate. Now, this is where sperm is made and stored here a little bit and pushed through this channel when it is supposed to be released, moves through here and joins another channel here and eventually joins another channel which it shares with the urine. Yes. So that's how it's done. Now, at these junctions here, you can see this part is shared, but this is not shared and that's not shared. So there's a gate here. There's a gate here, there's a gate here. Yes. So during the passage of urine, this gate is closed for the sperm. Okay. It's only the urine gate which is opened. Okay. Yes. During the passage of sperms, the urine gate is closed and it passes, this one only is using. Okay. Okay. Yeah. So in retrograde ejaculation, what happens is instead of the sperm passing here through here and using this channel to come this way, there's an obstruction here, and from here the sperm goes up. Goes back to where it's to the urine. Yes. So it is a problem of these junctions here, and the muscles, the valves which control the muscles, there are sphincters which control this, and these are very tightly regulated by the nervous system. Okay. Yeah. So if you have problems with the weakness of those muscles, or if you have a problem, and that weakness happens in people who have like diabetes, or people who have trauma to this area. Yes, like during prostate surgery. Now, when they are doing prostate surgery, they remove the whole of this gland, and you can see all these muscles go. Now, everything pours into a space, and so it is easy for it to go that way. That's why we usually advise people who are going to do prostate surgery, if they think in future they may want to have babies, they should have the sperms kept first, because this may become a problem. Thank you so much, Doctor. Yes. I think you've got the explanation very well, Sam. This is, someone is saying, Kennedy, what happens if you stop masturbation? I think if you stop masturbation. Yes, yes. So if you, the problem of masturbation is it conditions your brain to be static to something that is not supposed to be. Exactly. It conditions your brain to the stimulation with your hands of your genital system. You know, yes. So if you can remove, you can get control of your mind and you stop masturbation, your system will go back to the norm. Okay. It will go back to the norm, and you get back to normal. Yes. He's actually saying, can you go back to the way you were before? I think exactly. Yes, you go back to how you were, Kennedy. Yes. Thanks so much, Kennedy. Doctor, please, when are you discussing vaginal dryness? That will be another topic. Thank you so much. Hello, Beth and TV. Yes, my name is Peter from Mutungo. I have a friend who used masturbation for some good time, but he has failed to have a child for a year. Could it be the problem? Thank you so much for the teaching. Yes, this is Peter from Mutungo. Yeah, most likely that could be the cause. Most likely, and he definitely needs help. Okay. You can encourage him to come over and we see how to help him. Yeah. Thank you. Thank you so much. I think you've got the answer, Peter. Kindly encourage your friend to go to the hospital for better medical examination. Someone is saying, what is the importance of prostate and what causes prostate cancer? Balambola Titus. Thank you, Titus. Yes, what's the importance of the prostate? Yes, so prostate is this gland here. Okay. God put it right at this junction here. It produces some secretions which help it mixes, actually the secretions mix with the sperm as they pass. Now, those secretions, they help, you know, when the sperm is, the semen, which contains the sperm, is delivered into the vaginal canal during the time of intercourse, it clots. It actually doesn't remain like water. It immediately turns into like a gel. Okay. And that helps it to stick on the cervix so that the sperms, which are good, can swim into the cervix. Otherwise, if it remained liquid, it will all pour away and it will cause infertility. Okay. Yes. Okay. So the prostate is so and then after that gel is formed, after the sperms have gone, it has to become liquid again so that it can now move away. Now, the prostate produces secretions which cause these changes in the texture of the sperms, of the semen, when it is being delivered. Yeah. So don't confuse yourself, but it produces some substances which is added to the semen so that the semen is able to deliver the sperm very well. Okay. Yes. Otherwise, without the prostate, it can even cause infertility.
Thank you so much, Doctor. I think you've got that explanation from Doctor. Thank you, Balambula Titus. We have another one, Jasper. He's saying, I'm 25 years old. My issue is my right side testes pains me at times. Not every time, but it's been there for now 7 years. Wow. The right side of the testicle. Of the testes pains, yes. It's now 7 years.
7 years, yes. So he definitely needs a thorough examination because painful testicle can be because of a chronic infection, or can be as a result of maybe a scar in the testicle or in the scrotum. Sometimes these things can have an implication on your fertility as well, but also can be a sign of some swellings within that area. So that area is very complex. You cannot sit down when there's pain there. True. Please seek advice.
Seek advice and make sure the doctor.
You need examination. They can do a lot of things, including scan, examination. It needs to be sorted out.
Thanh you so much, Doctor. We have an audio coming in. We could listen to it before we read others. Yes, please.
Brother has a problem. Good evening. For me, I want to ask, like, my brother has a problem. Like they say that we went to the hospital, then they say that it came from a young age. But like his penis inches him a lot and sometimes it swells a lot. It swells.
Thank you so much. Is that the end of the audio? Sorry, someone is on the line. Caller, hello? Betan TV. Yes, please.
Yes, I'm Richard.
Richard, good evening.
Good evening to you. My question is...
Yes.
Yesterday I was having love affairs with my sweetheart.
That's good.
Yeah, sexual intercourse, but she realized some blood. I don't know what's causing that. And another thing I wanted to find out, when in the process when we are starting sex with her, she normally feels that pain when I'm entering. Even if she's prepared her completely when she's ready very well, she feels pain at that start of the game. I don't know what will be the problem.
Thank you so much, Richard, for your inquiries. Kindly listen to Doctor's response. Yes, Doctor, this is Richard.
So Richard is asking...
Oh, it's still, the audio is still on? Oh, thank you. I think we were distracted by the call.
So, like, what causes that? Because, like, when we asked in the hospital, they say that it came from since he was young. So, like, I want to know, can it affect?
Thank you. I think to stop there. Yes, some people are calling and distracting her explanation. She's saying she has a brother.
Yes.
And I think he was
There's
examined.
a problem with his penis and it swells and itches.
And itches a lot.
And from the hospital they said he got
started
the problem
from childhood.
From childhood.
Yes, yes.
Yeah. Well, I don't know what type of doctor he visited, but this is a case which has to be handled by a urologist.
Okay.
It is true there are some problems of the penis which people are born with, and it can present in any form. Sometimes this presents with the deformities of the penis, or maybe the opening on the penis is on the wrong side. Sometimes it bends the penis, and it sometimes can be associated with the itching because of the wrong disposal of the urine.
Okay.
Yeah, so this needs to be evaluated by a doctor called urologist who is specialized in that area.
In that department.
Yeah.
Thank you so much,
So
doctor.
that needs to be evaluated to find out the exact cause. But there are usually solutions to that. If it is something the person he was born with, it can be corrected.
Okay.
It can be corrected.
Thank you so much, doctor, for that response. We have many other messages here. My son's testicle on the left side. There's someone who called. Yes, I think Richard.
Yes, Richard called about.
Yeah, we could. Yes, let's first start with Richard.
Yeah.
He's saying when he's meeting the wife.
They
Yesterday,
get bleeding.
Yes, the lady bled, and every time they're meeting, she gets pain. Yes, what could it be?
Well, so that bleeding during intercourse, especially if it's a regular occurrence, should not be taken lightly. It may have a lot of implication on the health of the woman, especially. But this is associated with the pain. So we have to evaluate also whether the lady has other issues within her system. Okay. Yeah. So, but definitely for the sake of the health of the woman, Richard, you have to take that lady for evaluation. She may not be telling you the details of her health, but she will be able to tell the doctor, and they can be able to examine and help her. I know
sometimes we women, we keep a lot of secrets.
Yes.
Someone struggles with infertility, yet years back we carried out a lot of funny practices, but we are unable to open up. Yeah. Yes, okay. But in case she opens up, at least to a doctor, that will help them.
Yes, she definitely needs to be evaluated.
Thank you.
Yeah.
Thank you so much. We still have many questions here, doctor. This one is saying, my son's testicles on the left side is swollen, but can it cause infertility if he's 10 years now? For now, I think it's 10 years. Yes, and one side is swollen.
Swelling of the testicle, especially if it is painful, may be a sign of infection. And these are some of the things which can lead to infertility in future. Okay. Because infection which disturbs one testicle can actually disturb the other testicle, either directly by the infection going there, or indirectly by triggering the body to destroy the testis.
True.
It will destroy the infected testis, and it will also destroy the other testis. So this is something which needs to be attended to, definitely.
Thank you so much. There's someone calling. Caller, hello?
Hello?
Yes, please.
Hello?
Hello, good evening to you. We can hear you.
Hello?
Hello? I think the network. Hello, we are hearing you well. Go on. Sorry, it's network. And then, hello, I've watched a second time now. I was operated of a baby in 23. Ceased to have periods. Can I be helped? What's the address? Please, longing for help. Rachel. Someone is calling. Caller, hello?
Hello?
Hello, yes, please.
Yes, good evening.
Good evening to you. How are you?
I'm okay.
Yes, whom are we talking to?
You're talking to Robert.
We're talking to?
Robert.
Yes, Robert.
Yes, now, I have a problem.
Yes, please.
I had a surgery.
You had a surgery?
Overseas with my left support.
Okay.
But ever since normally, the appetite of sleep is not there. How do I do it?
Thank you so much, Robert. He's saying he had a surgery, I think on his testicle, something like that. But ever since that, he has no appetite for intercourse. What could be the problem?
Well, It's very hard to tell what the surgery was for. Some of the things may not be related, but it could be related to the surgery. So it's good to know the details of what the surgery was for.
Okay.
It may be surgery like hernia on the scrotum, which is not involving the testes. Yes, but also it could be something related. So it's not quite clear but I think since his desire for the sex is low, whatever the cause is, whether it is related to that or something else, needs to be helped.
Thank you so much.
He has to go over to the hospital and they see.
Seek medical help.
Yeah.
Thank you. You have another caller, Doctor. Bethan TV, hello.
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 Good evening.
Good evening to you. How are you?
I'm okay. How are you?
I'm okay. Who is calling?
This is Joseph.
This is Joseph. Joseph, yes. Go on with your question.
Yes. Actually, my point is,
Actually, I'm now 55.
Pardon?
I'm now 55 years old.
45.
Okay.
I'm 55 years, yes. Now, I have a problem of electing. And then when I elect, then I lose the water for good. So what's the problem? Is it the age or maybe sick?
I didn't get Joseph well.
Joseph,
I didn't hear you well. Can you please, you speak calmly, calmly.
Slowly, okay. I'm back the point.
Okay.
I was saying I'm 55 years old.
Okay.
55 years.
But I have a problem of election.
Okay.
Election, yes.
For quite about 5 to 3 years ago.
Okay.
Is it a problem from the age, or maybe I have kind of problems in my system?
Thank you, Joseph. Doctor has clearly heard you. Thanks so much. He's going to respond back to you.
Yep.
He's 55 years
Yes.
old, and he doesn't erect for the past 3 to 5 years almost. Yes, what could be the problem?
Yes, so he's 55.
55.
Well, yes, so usually erection issues can occur between the ages of 35 to like 60 years there. And there are different causes of this. Yes, they could be psychological, they could be hormone related, yes, or there could be some other issues like diabetes or high blood pressure.
Okay.
Yes, so all that needs to be evaluated, and we need to find out exactly what the cause is. Yes, even if it is related to the age, there are treatments available. It can be sorted out.
Okay.
Yeah, the longer you spend without having the problem corrected, the more difficult it gets. So I would advise him to seek help immediately so that the issue is sorted.
Thank you so much. We're running short of time. Rachel, we haven't responded back to Rachel. She, I think, stopped her menstruation some years back when after some operation in 2003. And she's saying she really needs help, and she's looking, I think, she's looking to meet, I think, you. Yes, Rich, I think you can come to Bethan Women's Hospital, Luzira, depending on where you're from. Luzira is the main branch. There is also Entebbe Road branch. You can come to Bethan Hospital. You can't fail to get help, I'm sure. Thank you so much, Rachel. Good evening, doctor. My question is, does hernia affect the growth of the penis, and does it affect infertility in men? Yeah, so hernia is a swelling of contents from inside the abdomen, which goes through some hole, and in most cases it ends up in the scrotum. Okay. Yeah, so things are protruding through some spaces of the muscle and coming out. Now, unfortunately, these spaces are shared usually with the tubes of the sperm as well. Okay. Yes, and also the blood supply. Now, when they're doing surgery for these hernias, sometimes they can tamper with the blood supply of the testicle, and so in some cases, not common, you can have issues with your fertility following hernia surgery.
Usually it's not before the surgery, no. It is usually after the surgery, especially if the surgery is not done by somebody who really knows hernia surgery very well. Yeah, you know, people usually take hernia surgery very easily, lightly. It's not. It has a very complex anatomy. You can actually interfere with somebody's fertility if you don't do it well.
Thank you so much.
Yeah.
And this is Daniel. Does Bethany Hospital treat infertility in men?
Oh yeah, we treat the whole infertility.
Okay.
Yeah, so both men and women. Yeah, we do.
Thank you. Hello, Doctor. Medical Minds, thanks for the presentation. What could lead to the conditions where passing urine doesn't come out all? Breaking towards, I think he didn't type it well. Come out at once. Yes, doesn't come out at once. Does it have a solution? I think that is something you've been explaining.
Yes. So that intermittent passage of the urine signifies most likely a problem of the passage. Either the prostate is enlarged, it is squeezing up there, or the urethra has scars down, maybe due to infections, and so the passage is narrow and it has to be forced through. So that is somebody who needs that evaluated properly. If he's above 35, it will be an issue of prostate.
Okay.
Yes.
Okay, thank you. And then we are running out. I think we have 3 questions which we didn't attend to, but we shall do it. Doctor, our last segment, please.
Yes.
Yes, there are some good people who are following up and they want to hear the facts from you. Our last segment, myth, facts or false. Number 1, infertility is common in men with heavy weight and poor diet. True or false?
in heavy now the current information we have is that is true. Yes, people who are heavier in weight than men have lower reproductive potential in terms of not only their ability to perform sex, but also their quality of sperms are low in terms of numbers. We now know they have problems with the hormone balancing. So that is true, and it's a very current information.
Thank you so much. Yep. Men who sit for long, like drivers, pilots, and cyclists, are likely to become infertile. True or false? Thank you so much. Diseases like pressure, diabetes can cause infertility. True or false? Thank you so much. Heavy workout and exercises can cause male infertility. We talked about this.
Yes, that is very true.
100%. Male infertility is hereditary. True or false?
Some of them.
Some of them.
Yeah.
Tight boxers can cause infertility too. True or false? Thank you so much, Doctor. I think you're seeing the percentage. Thank you. Heat and vibrations from phones and laptops can cause infertility in men, especially when they're put in pockets. True or false, Doctor?
Very, very true.
Very good. This is 10 out of 9 out of 10. I think you can see now where infertility originates from. This has been Medical Mind. Thank you so much for being with us. I think we shall host Doctor again next Sunday, where we shall look at another interesting topic as far as our health is concerned. Doctor, please say your last word to our men who have been viewing us all along from the beginning.
So I just want to applaud them for keeping on the line.
Thank you.
And I just want to tell them that all these problems have solutions. Don't fear. The earlier the problem is realized, the better the outcome of treatment.
Okay.
Yeah, infertility affects both men and women.
Okay.
Yep.
Thank you so much. From the medical team, from the Medical Mind team and all the production team, we wish you a very good night. See you next